The COVID pandemic really underpinned the importance of global standards in healthcare.
The supply of a lot of products as a result of COVID-19 across the world became very critical and in short or limited supplies.
It's personally painful when we would see inventory trapped someplace where you need it somewhere else. And they may have picked a location that's not where we wanted it to go, and that you can't get it or you can't find it because we don't have that visibility.
In order for us to be able to find where our supplies were, to predict how long our supplies would last, we had to understand the source.
We have learned that we are all dependent on efficient and safe supplies and supply chain, and standards make it just so much easier and much safer for us to provide health care.
It's that fact alone that has made us realize that we have to do it with global standards being applied.
As we look at the future with the vaccines that are coming in, the challenge or the issue we will have in the very near term is going to be identifying perhaps what products were given to which patients and when, if they don't happen to have that barcode that can be scanned and captured.
And that's what GS1 is all about, is how we're accelerating this impact really on outcomes, on the healthcare outcomes for people around the planet.
We need vaccines to get back to a normal life and to overcome this global health crisis.
Trust has always been an essential component in healthcare, and it's hard to imagine a successful outcome of the global COVID-19 vaccination effort without it.
Getting the vaccines where they need to go, I think, is the most important aspect, in that they are life-saving.
The information management before and after administering the vaccine is important.
In that continuum of moving toward this global standard, not everyone is going to implement at the same pace.
There are things that we can do short of full track and trace that will bring benefit and help us protect the COVID vaccine.
Let us build safe systems for now and the future, so we not only have the right vaccine, but the right vaccination to protect the people and eliminate problems.
The COVID pandemic really underpinned the importance of global standards in healthcare.
The supply of a lot of products as a result of COVID-19 across the world became very critical and in short or limited supplies.
It's personally painful when we would see inventory trapped someplace where you need it somewhere else. And they may have picked a location that's not where we wanted it to go, and that you can't get it or you can't find it because we don't have that visibility.
In order for us to be able to find where our supplies were, to predict how long our supplies would last, we had to understand the source.
We have learned that we are all dependent on efficient and safe supplies and supply chain, and standards make it just so much easier and much safer for us to provide health care.
It's that fact alone that has made us realize that we have to do it with global standards being applied.
As we look at the future with the vaccines that are coming in, the challenge or the issue we will have in the very near term is going to be identifying perhaps what products were given to which patients and when, if they don't happen to have that barcode that can be scanned and captured.
And that's what GS1 is all about, is how we're accelerating this impact really on outcomes, on the healthcare outcomes for people around the planet.
We need vaccines to get back to a normal life and to overcome this global health crisis.
Trust has always been an essential component in healthcare, and it's hard to imagine a successful outcome of the global COVID-19 vaccination effort without it.
Getting the vaccines where they need to go, I think, is the most important aspect, in that they are life-saving.
The information management before and after administering the vaccine is important.
In that continuum of moving toward this global standard, not everyone is going to implement at the same pace.
There are things that we can do short of full track and trace that will bring benefit and help us protect the COVID vaccine.
Let us build safe systems for now and the future, so we not only have the right vaccine, but the right vaccination to protect the people and eliminate problems.
The COVID pandemic really underpinned the importance of global standards in healthcare.
The supply of a lot of products as a result of COVID-19 across the world became very critical in short or limited supplies.
It's personally painful when we would see inventory trapped someplace where you need it somewhere else. And they may have picked a location that's not where we wanted it to go, and that you can't get it or you can't find it because we don't have that visibility.
In order for us to be able to find where our supplies were, to predict how long our supplies would last, we had to understand the source.
We have learned that we are all dependent on efficient and safe supplies and supply chain, and standards make it just so much easier and much safer for us to provide health care.
It's that fact alone that has made us realize that we have to do it with global standards being applied.
As we look at the future with the vaccines that are coming in, the challenge or the issue we will have in the very near term is going to be identifying perhaps what products were given to which patients and when, if they don't happen to have that barcode that can be scanned and captured.
And that's what GS1 is all about, is how we're accelerating this impact really on outcomes, on the healthcare outcomes for people around the planet.
We need vaccines to get back to a normal life and to overcome this global health crisis.
Trust has always been an essential component in healthcare, and it's hard to imagine a successful outcome of the global COVID-19 vaccination effort without it.
Getting the vaccines where they need to go, I think, is the most important aspect, in that they are life-saving.
The information management before and after administering the vaccine is important.
In that continuum of moving toward this global standard, not everyone is going to implement at the same pace.
There are things that we can do short of full track and trace that will bring benefit and help us protect the COVID vaccine.
Let us build safe systems for now and the future. So we not only have the right vaccine, but the right vaccination to protect the people and eliminate problems.
Good morning, good afternoon, good evening, ladies and gentlemen, colleagues and friends from across the world. Welcome to our second executive dialogue around the topic of trust in the COVID-19 supply chain in relation to a white paper which Deloitte published at the beginning of the year. Before I hand over to the moderator for this session, it's my duty to remind everybody of the GS1 competition law. So please, no discussion on customer prices or anything which could lead us in antitrust issues. Thank you very much. You can post questions. Please do so. Feel free to put questions forward. We will address as much as possible and might have a little bit a longer session than indicated if there are many questions. Also, if you can't answer a question, please put your name and we will take care that we come back to you afterwards. And with that, it's my big pleasure to hand over to the very capable moderator of this session. It's my pleasure to welcome Suzanne MacDonald from Deloitte, Ireland. And Suzanne has worked a long time already in healthcare. And interesting-wise, she has also worked with the Irish regulator for more than 15 years. And she and we share really the love for red, obviously. So my big pleasure to welcome you, Suzanne, and a big thank you that you are taking the time for doing this and make yourself available. Over to you. Thank you.
Thank you. Good morning, good afternoon, good evening, wherever you are in the world joining this call. And welcome to the second GS1 Executive Dialogue. And as Ulrike said, today we're looking at how global standards can contribute to the efficient distribution and administration of COVID-19 vaccines globally. My particular thanks to Ulrike and indeed to GS1 on behalf of myself and today's panelists for the opportunity to share our experience of the COVID-19 supply chain over the past year. To set some context, maybe before we start with our panelists, we might look to the Deloitte white paper that Ulrike referenced at the start, and this was published in late December. That paper highlighted the tremendous benefits to COVID-19 supply chain management resulting from the adoption of GS1 standards. And these are benefits that arise for the supplier, the buyer, and ultimately the patient in terms of a safe and efficient supply of authentic products. Throughout 2020, we experienced very significant supply chain challenges. And many of you on this call will have encountered some very difficult scenarios, and such as, where can I get my product? Can I be sure I'm buying the right product? Is it from a reliable supplier? How can I be sure that this product reaches the intended audience? These are challenges we've all faced in the past year. We've also experienced exposure to potential counterfeiting at a time of extreme global demand and supply chain uncertainty. And this is a very worrying impact, and it's created potential risk for buyers and, more importantly, for patients. And it's also created reputational risk for the authentic product owners. Very importantly, and I know this has been raised on some of the other dialogues, it's important to highlight the enormous obstacles that those in low and middle income economies have experienced in gaining equitable access to life-saving supplies. And notwithstanding programs such as COVAX, this situation continues to have its own particular challenges. And many of you on this call have raised that in some of your questions that have been raised. These experiences have shaped our view and as articulated in our white paper. And we believe that it's important that we learn from the pandemic and we build on the collective experiences that we've had to develop a sustainable solution, not just for the pandemic, not just for COVID-19 response, but for the wider and future use of products. And we'll have learned nothing if we don't put our experience into action. That's our belief. We believe that we must promote greater industry collaboration across the value chain. And I suppose everybody must be a full participant. It's not optional. We need to fully embrace and promote global standards to ensure that there's supply chain security. This isn't a burden, it's now a necessity. And we need to be proactive in managing equitable access to vaccines. It simply isn't acceptable to vaccinate the wealthy economies. This is a global problem. And we also need to use clear and transparent language and communications to promote greater confidence. That's an important factor in all of this. We believe that the standards create a common language, and this language allows us then to support a fast-moving and trusted supply chain. Without this common language, it's impossible for each component of the supply chain to work effectively with the other. If ever we've seen the potential benefit of standards and identification, it has been during this pandemic response period. While it's been a really challenging year for us all, the cooperation experienced between governments, manufacturers, NGOs, regulators has demonstrated the combined commitment to solving this incredibly complex problem. Since our last executive dialogue, things have moved at quite a pace, and our three panelists joining us today have been fully immersed in the rollout of vaccine within their respective geographies. And they're here today to share that experience and to articulate how the use of standards has supported their work. I'm really pleased to introduce Dr. Peter Stevens from New Zealand. New Zealand, as we know, has been the poster child for the pandemic response, so that's really interesting to hear from New Zealand. Ms. Shiobain Duggan from Ireland, and Mr. Ozgur Gomec from Turkey, all bringing very different perspectives from their respective geographies. Before I hand over the panelists, just reminding you again that there'll be a Q&A session at the end, so please feel free to submit your questions, and we'll provide some feedback afterwards if we don't get the opportunity to respond to all of your questions. I'm going to start by handing over to Peter. I'm going to introduce him. He's got a very impressive background. So, a geneticist by training, Dr. Peter Stevens has been CEO of GS1 New Zealand since 2004. Prior to joining GS1, he led the KPMG Consulting New Zealand Strategy and Business Transformation Practice. He was also a member of the National Standards Body in New Zealand, has lectured at Victoria University of Wellington. He also started his career in Apple Computers, and he currently serves as a ministerial appointee on the Standards Approval Board and also on GS1's Global Advisory Council. You're very welcome, Peter.
Kia ora. Good morning.
Good morning.
Good morning, yes. Peter Stevens, lovely to be here, and thank you very much for the invitation. So my task today is to take you through a little bit of background about what New Zealand has done, and so with that, I would like to start off by showing you, in some ways, a little bit of perhaps why New Zealand, and these are very partisan views about why New Zealand has perhaps been in the news. So to start that off, I've got some sample countries here, some of our trading partners and people that countries that we would often like to compare ourselves to. And this is some of the statistics that come from Worldometer. So we have a very small population, 5 million, compared with some of the countries that are on the screen there. But I think the last two lines are one of the reasons why New Zealand has been seen as unusual, perhaps, globally. Deaths per 1 million, 5. And so we're very low in terms of the number of deaths and very low in terms of the number of cases. We've not been COVID-free, but we have had community incursions of COVID, and then each time COVID has been eliminated. And in fact, we're in a situation now where we're unusually just celebrating the America's Cup victory, and we can have thousands, literally thousands of people together. There's no problems whatsoever. So I suppose, why is this perhaps? Why has New Zealand been somewhat unusual and been remarked upon? Well, here's a variety of different, what the media is saying. So this is a first-hand account from a doctor who now lives in New Zealand. And I'll draw you to the last paragraph. It says, where, as an outsider now working inside the system, I believe there is something to the culture here that also plays a significant role in that success. New Zealand's academic, political and scientific institutions all emphasise communication, empathy and cooperation. So this is a US doctor. Another sample from the Lancet. There's been academic journals already published about why is the outbreak unusual and why has elimination worked multiple times. News globally focusing on our Prime Minister and and indeed her leadership, and we'll come back to that point in a moment. So what are the ingredients of the successful response? And again, this is in some ways a personal role, even though there are academic papers out here. Firstly, I think it's not a surprise that we're a long way away. We are a long way at the edge of the world. But of course, and we're also an island, but there are other islands and there are other places a long way away as well. I think a second thing, it's very noticeable that New Zealand went what we call hard and early. We closed the borders very early, and although the borders have not been sealed, we've had literally hundreds of thousands of people come back to New Zealand. Typically, they're returning Kiwis, and they need to have a reason to coming here. And we've had manage and quarantine processes. But I think in some ways, when we get closer to it, when we talk about leadership, and here is our Prime Minister that was referenced before, and the Director General, and Director General talks about that leadership is an invitation to collective action. And I think that's the secret here, really. That word collective action has been what's been critical, along with science-based decision-making. So science has really driven it, and there's been a tag team of the Minister, the Prime Minister and the Director General that work together hand in glove to make decisions, seemingly so to Kiwis, so much so that we see that we're in a team of 5 million has been the word that has been used. The Director General himself has become quite a pop star, and in fact, T-shirts are being created. These are T-shirts that I, in fact, own one of these, called the Curve Crusher. These are T-shirts put out for charity for anti-violence and merchandise. So it's quite surprising that a Director General of Health would become a pop star in a way. And fourthly, it's been commented on that we have a relatively cohesive society and there's comparatively less polarisation. And importantly, in Western countries, the media still has an obligation to be fair and unbiased. Now, I've perhaps been a little bit provocative here with the images on screen, but we do not have the extreme right-wing papers and media outlets in New Zealand that other economies often have. So certainly, and because of St. Patrick's Day, and the Irish, we did have some luck. Definitely, we've been lucky here. We've created some luck, I suppose. But relative to what we're here for today, there has been world-leading contact tracing. And the surprising story is, in some ways, GS1 has been quite part of that in ways that I'm going to outline. So let's dive a bit more into that. And to understand why standards have been important in this, we have to back up the truck really to before COVID. And I'm going to do this in two parts. The first one is called the New Zealand Business Number. So the New Zealand Business Number is a strategy by the government to do legal entity registration via GS1 global location numbers. So every business has and is required by law to create and update business data. And so the New Zealand Business Number, every entity in New Zealand, state entities, private entities, has a global location number. There's a registry. There is an act that gives penalties for misuse of the GLNs in law. There's APIs. It's very sophisticated. And there's an ecosystem around this New Zealand Business Number registry. All of that data is, by the way, syndicated up into the global registry and GEPIA. For those of you that are from GS1, you'll know what those words mean. So this New Zealand Business Number registry has been around for quite a long time, and it has a metadata attached off this. This is an example from New Zealand's global scale company, Fonterra. And this database has been pioneered to drive network standards, interoperability for facilitating trade, and provide a high integrity identifier, legal entity identification, for business and the government to use. So this is a key system, a building block that we have worked for GS1 has worked with the government for many years, the last 7 years. And essentially the government assigns, in partnership with us, the New Zealand business numbers at the front to all different types of categories: companies, government agencies, sole traders. And then in a separate part, which we'll come to, GS1 works to create additional global location numbers to physical locations, functional and virtual locations. So this is a key building block of our infrastructure here. So the second part of that is to understand we've got a legal entity identifier. The government had intended to build out off that legal entity identifier a thing called the location registry. It was built as a public-private partnership with GS1, and the idea is to use what are called organizational parts. Now, I need to explain that. So the organizational part is the ISO term for a GLN. And importantly in New Zealand, the ISO standards for GLNs, GS1 GLNs, were adopted by the New Zealand National Standards Body as key New Zealand standards for use by government departments. So the GTIN, all of the other standards that you would normally associate with GS1, the ISO versions of those were adopted as New Zealand standards in 2019. And the reason why that was done was to drive infrastructure use cases, to drive network benefits of people, those of you that know EDI, business to government communications, and international traceability. So this was a key part of what was being built for New Zealand. And then we went into pandemic. And on the 18th of April 2021, we come to health. We received an email from the Ministry of Health, and typical Kiwi language here, we are wanting a standard for a QR code, a poster, so that New Zealand people can check in at locations to remind them where they have been to support faster contact tracing. We are wondering if your team already has a standard or some thinking that they could offer. And then I love this. I don't mean to be pushy, but this is of national importance, so we'd appreciate a pragmatic and quick response. So, and the key word that came out was, please don't be creepy. We do not want creepy. There was feedback already globally that Bluetooth tracing was seen as being creepy. People did not know what they were doing, who they were being traced with, and they didn't know how it worked. So essentially, the journey that was created was that businesses off their New Zealand business number would register a location in against their New Zealand business number, create a poster, what we call a COVID poster, tracing poster, which they would stick on the door or every room if they wish, and then citizens would come in and scan when they get to that location. So last year, this was put into operation in less than about 2.5, 3 weeks, and the system was launched. So it's an app which enabled scanning, which embedded a global location number that was linked to the business's legal entity identifier. And citizens would scan that, and they could see where they were going, a personal diary, and if required, they could share that with the government regulator if they caught COVID. And so let's look at the data here, and this shows you the registrations in the blue bars right at the bottom. It shows registrations of the app by New Zealand citizens. The yellow line shows the scanning activity, and each of the lockdowns at the top is in the last year. You can see immediately when there was a lockdown, you could see sensitivity and citizens started scanning again. And the blue line that's at the bottom, at the right, is when Bluetooth was enabled. And you can see that most people have adopted Bluetooth. And behind that, there was the total number of scans in the grey bars. So what did that look like? The statistics are quite impressive for a small country. 522,000 unique locations have been created by New Zealand businesses off the New Zealand business number, each with a GLN. 11,000 have been adopted by one organisation alone. 2.7 million app registrations, 202 million scans, 2.5 million in a day. So this has been successful, not perfect, but of course has complemented the existing scanning. So we're very proud of our role. In fact, you can see that we helped power the data behind the new normal in our annual report last year. And in some ways, New Zealand has been involved in this. What's next for GS1 New Zealand and the pandemic? This is ongoing because contact tracing is still critical to New Zealand. And of course, we're a small part of a very big picture. And now vaccines are starting to roll out, and these global location numbers are being used to help track where the vaccines are being used. After all, one of these posters is by law on every single post, every single business and every single location in New Zealand at the moment. Back to you. Thank you.
Very many thanks, Peter. That's fascinating, and I have so many questions for you. I have to contain myself until the end of the session in case I get carried away. It's been a fascinating presentation, and we have so many questions for you. So what I'll do now is I'll move on to our next panelist, and what we'll do is compile our questions to the end and have a good, well-rounded discussion. So I'm going to start by inviting Siobhan maybe to join the next session. So Siobhan is the Director for Innovation and Healthcare at GS1 Ireland. She's my countrywoman, so I'm really pleased to see her here today. Siobhan has been leading the healthcare strategy for GS1 Ireland since 2010, and she's been very actively engaged in developing solutions to assist with the COVID vaccination programme in Ireland. Prior to joining GS1, Siobhan worked for Hewlett Packard for a number of years, about 10, I understand. And Siobhan is also a graduate of University College Dublin Business School. You're very welcome, Siobhan, and look forward to hearing your presentation.
Thank you very much, Suzanne, and I'm delighted to be invited to speak here today. I will speak about the GS1 Ireland experience, about our involvement in the national vaccine rollout. Firstly, I'm conscious many of the audience are frontline, so thank you to all the frontline staff who've been working so hard to keep us safe. Secondly, I'm presenting, but this has been a real team effort from the whole team in GS1 Ireland, combined with the fantastic support from our boards, and specifically my colleagues, Dennis O'Brien, who's been very actively involved in the whole design and architecture of the work we're doing, and my colleague, Amanda Green. So I think if I can go to the next slide, great. So, and I would also like to say that finally, this has been a fantastic collaboration, and full credit to the project team in our health service, the HSC, who are working tirelessly to stand up the national vaccination system. So, as I mentioned already, I'm talking about the Irish experience. We had our National Day yesterday, so it's St. Patrick's Day, so happy St. Patrick's to everyone out there. As you can see here, similar size to New Zealand in terms of population, and we have the budget, I suppose, has increased to support COVID. We have primarily it's a public health service with some support from private healthcare as well. And GS1 standards are actively used, and there's applied across the health service. So we were in a very good position, I suppose, to assist our health service, and lucky in a way, the way things fell, that we had the opportunity to support. So for those who aren't familiar with Ireland, we have Department of Health, and we have our health service, which is called the HSC. So similar to the NHS in the UK. So when I talk about the HSC, that's our health service. A year in the pandemic, I think certainly a year like no other. And there has been, I suppose, many challenges in terms of the delivery of healthcare. The PPE shortages, where the GS1 barcode and the GTIN is certainly adding value in terms of tracking and finding and knowing what we have. Test and trace, where we're also involved in the identification and tracking of the boxes from the test centres, boxes of samples from the tests from the centres to the laboratories, and now specifically today's discussion around the mass vaccination centres. And we often talk about what drives change and what drives the adoption of the GS1 standards. And often it's, unfortunately, it's a catastrophe or a pandemic in this case, which drives the change. We're seeing a huge uptake in technology, and particularly e-health technology to manage remote monitoring of patients, and lots of other technologies in this area. But I think it's very important not to forget that it's a combination of technology and standards which deliver safer, more efficient care, and we'll speak more about that in a moment. As both Ulrike and Suzanne made reference to the excellent report recently published by Deloitte, and I really like the quote here that talks about the importance of tracking every single dose, and that's a huge challenge for countries around the world to address. Our national newspaper in Ireland, the Irish Times, they also recognise this is not simple, but we have a plan. And in terms of the rollout for the COVID vaccine, so it's a national rollout. We have, I suppose, the HSE is our National Health Service, so they are tasked with the rollout. They had been due to procure an upgraded system to try for the immunisation programme. So they went out and procured a new national system for the tracking of the COVID vaccine rollout. And GS1 Ireland are delighted and proud to be actively and directly supporting the HSE in this rollout. The time frame, so the first vaccine happened at the end of December in St James's Hospital, and GS1 Ireland has been involved prior to the 4th of December, but actively involved in this specific programme since then, and with 2 full-time equivalents on the project since the 4th of December. And we're now at the point where in Ireland it's being stepped out to the rollout of the mass vaccination clinics. In terms of the challenges for the vaccine rollout, I think we're all familiar. They're complex vaccines. They require cold chain or ultra cold chain in some cases, multiple doses, saline or no saline. So there's lots of complexities with this, and that presents challenges for the rollout of any IT system. In terms of how GS1 is supporting the programme, I've broken it down into 4 key areas. The first one is, I suppose, the bread and butter of what GS1 does. It's around the licensing and identification. So the licensing of our numbers, and I suppose we were already actively involved in providing identifiers to our health service, particularly for locations. So again, you can see the dots joining between what Peter is doing in New Zealand and also the use of GLNs here in Ireland as well, adding huge value, as well as other identifiers for people and products as well, as we can see on the vaccine boxes. So that's one part. The second part is actually labelling. So GS1 does a lot of work around how to structure data into barcodes, and also how to tag data so that you have it structured. It's not just a number and a barcode, but it's meaningful data that can be easily pulled out of the information in the barcode and put into the system. So we looked at specifically a new label for the Pfizer vaccine, because when that is removed from the ultra deep freeze, it needs a new expiry date. So we'll speak about that in a moment. And at the moment, it's a work in progress, but we're looking at what a standardised label might look like for a vial and a syringe, and for the tracking within the mass vaccination centres. And thirdly, software. So there's lots of great software out there, but not all the software is designed to really utilise or decode the GS1 barcodes. So when it came to actually receiving the vaccine boxes into the locations within the HSE, we've stepped in to provide some software to do that, and at the moment that's installed in nearly 700 locations within our health service. So that's adding value in terms of removing some of the manual effort required to track where the vaccines are going. And the fourth piece is around the advisory of how the standards can be applied within the design of the IT system. So it's more than just understanding the identifier and what the identifier does, but actually understanding the logic of how traceability can be designed in to make sure that the design is done at the start, done correctly, safely, and doesn't fall over in the future. So this graph here, the digital thread from the Deloitte report, is a very nice flow of how the identifiers map from the point of manufacturing right through to the point of vaccination. And you can see here that for the Irish rollout, we are utilising a number of the different identifiers at various points. And I think this slide here is a really good visual overview of the work we're doing, and I'll go into some of the details in a moment. So we're starting off with the distributor. We have a national cold chain distributor for the distribution of the vaccines. The vaccines come in, be it Pfizer, Moderna, AstraZeneca, or whatever else will come in the future. They come into the distributor. For the Pfizer only, there is a new label applied. So taking the information from the manufacturer's barcode and enhancing it with a couple of additional data elements. The second piece then is those vaccines are shipped out to the various HSE vaccination locations. And at the moment, we're providing a software component that allows the pharmacist or whoever is receiving the vaccines to receive them into the pharmacy, scan them in, upload them to the system, the national system, via an API, and that information, the batch information relating to those vaccines, is then presented at the point of vaccination to the vaccinator. We are working on a final point, which is work in progress in terms of a proof of concept to demonstrate what labelling, so standardising the labelling of the vials and syringes and the tracking of the vials and syringes within the mass vaccination centres. So that's a proof of concept piece that we're working on as well. So firstly, the labelling piece. So it's important to point out that all of the manufacturers currently have GS1 barcodes on the boxes. And that was, I suppose, partly an answer to the Falsified Medicines Directive, and partly because the industry has standardised, particularly pharmaceuticals have standardised for quite a while on the GS1 standard. So you've got key data elements relating to the batch traceability of each vaccine on the vaccine box. Now, for the Pfizer vaccine, that's 195 vials in a box. So the box of 195 vials has the GS1 barcode. But when you get down to the vial level, then you don't have the identification at that point. And that's where the challenge of tracking the vials within the vaccination centres happens. And you can see here also the new barcode that's created for the Pfizer vaccines. The AstraZeneca, Moderna can be scanned through and they don't need to be changed. So if you're interested to know what that new barcode looks like for the Pfizer vaccine, this is it. It's another version of the manufacturer's barcode. What was interesting was when we designed the label initially, we had to put on an expiry of 5 days, but very quickly we had feedback we needed to change that to 120 hours because the time element of this was so critical. So the standard was able to cater for that, which was great. Then the second piece, as I mentioned, is the software bit. So we start off, this is a very quick overview of what the software does. So you log in and you choose your location. So it's obviously very important that you're scanning the vaccine into the location that you're in. And similarly, for the national vaccination system, they're in the same location, and then that product gets shared to the vaccinator within the location. The second step then is the scan of the barcode on the box. And in some cases, for example, for the Pfizer, you may need to confirm the quantity just to verify that the quantity is correct, because sometimes the vial counts can change because the big boxes are being packed down into smaller boxes. So confirming the quantity, save the records, and then when the receipt of goods is done, that information then, whether it's 1, 2, 3, 4, 5 boxes, that's all then uploaded via an API to the national vaccination system. And that's then ready at the point of vaccination. So the before and after, I think, is important here. So prior to having the software to scan the vaccine boxes and the information was being keyed in, this is error prone, time consuming, and there were backlogs building up. and also additional resources required to make sure all of this information is captured. Now we have something that allows people to receive the vaccines quickly. It's safer. It's the records are now up to date, and we're getting reports that the data quality is excellent as well, which is a key point. As you know, vaccinating a full population is certainly labour intensive. And safer, as the vaccine information, the batch information, doesn't get touched by humans. So it's scanned from the manufacturer's barcode right through to the point of vaccination. So then if we look at next steps, so I've spoken about what we've done around the work, and we've involved in many different calls to try to help also the design of the overall system in terms of the barcode scanning piece. The final piece then is the proof of concept that we're working on, which is the labelling and tracking of vials and syringes in the vaccination centres. Depending on the centre and the amount of staff and the setup of the centre, centres might choose to issue vials to the vaccinators, or in some cases they might decide to pre-draw, so draw up the syringes in the pharmacy and then send out those syringes to the vaccinators. For either model, identification is required, and at the moment what is being done is quite manual. So anyone who's involved in the management of a vaccination centre, they're doing some form of manual tracking. So a lot of handwriting of labels, and of course that is prone to error, it's labour intensive, and it's risky when you're in a very busy centre and trying to keep that overview as to how many vials went out at the start of the day, and then as you get towards the end of the day, what's left out, how many vaccinators do you still need? People are hanging around waiting to know, am I needed, am I not? Whereas if you move to a standardised label that's electronic, it allows then for, it makes it much easier for people to have visibility of exactly what, sorry, I just need to go to the slide so I can see it, sorry. So it's much quicker and safer, it's standardised, it's easy for staff because they can read the information on the vial, and we've even had feedback that because they can see the expiry, they have more confidence in what they're getting. What they get is what is in the syringe as well. A real-time dashboard reporting available, and end-of-day reconciliation is automated, which was prior to that a very time-intensive process and very, very tedious. Vial yield can be captured, and the reasons for discard is also captured, which is rare, but it's important to capture it when it happens. And a national dashboard is also available. So as I've mentioned, that is very much proof of concept, but certainly a great opportunity as well. So in terms of then the conclusion, I suppose the final, the closing comments, this is a huge opportunity for safer, more efficient care. And if you're looking at how this can be applied within your country, I suppose the key is to understand GS1, the standards, and to design in traceability. As I've said, the manufacturers are providing the barcodes, the GS1 barcodes, so it's there, the information is there. It's now about understanding what systems you have in place and how that functionality can be designed in to allow that track and trace of vaccines to happen. And for healthcare providers to understand what GS1 can do in terms of the value add, and include in system requirements, include in labelling specifications, and just designing in the traceability standards. So the real win here is improving patient safety, and there's great time savings, and the real cherry on the cake then is the data to inform the real-time data and accurate data, complete data to inform clinical decisions. Thank you, Suzanne.
Thanks so much, Siobhan. That's really interesting. Obviously, I'm followed it very closely myself, being from Ireland. So it's been a really interesting experience, and we'll catch up. We've quite a number of questions coming through from the participants, which is fantastic to see, and we'll try and respond to some of those directly at the end of the session. I'm delighted now to hand over to Ozgur. Ozgur Gomec has worked in the pharmaceutical industry, ranging across a whole range of areas from production to supply chain for over 11 years. He joined VISIOTT Track and Trace Solutions 6 years ago, and he's been working on the development of traceability projects for manufacturers around the globe. Ozgur designs solutions for manufacturers in areas such as Turkey, all across Europe, Russia, and in the USA. VISIOTT itself is part of the solution provider for vaccine traceability operations in Turkey, and he works specifically on COVID-19 vaccine traceability operations. So he's very well placed to share his experiences with us here this morning. Thank you very much, Ozgur.
Thank you, Susan. Good morning and good evening to everyone who is watching and listening to us. Thank you for giving me this opportunity to present today. In fact, we will be talking and exchanging ideas about the vaccine traceability today. We all facing new challenges. As we know, the pandemic is in our life for more than a year. We are all in effort to get rid of the pandemic in the fastest and the most effective and the secure way. Our duty is to find the right solution by meeting on common ground and with light organizations. I hope that we will all overcome COVID-19 as soon as possible and get rid of this outbreak. Today, I give a little bit information about the VISIOTT. I'll try to explain how to implement the vaccine traceability system and immunization in Turkey. VISIOTT is one of the global players in the world that provides traceability system for end-to-end requirements of the customer. It provides a local support to its customers, so its officials and the distributors in Germany and Brazil. VISIOTT has been producing the most comprehensive solution for vaccine traceability in Turkey since 2014 and has played an essential role serializing vaccines in the pandemic process. Today, I will try to explain how vaccine traceability in Turkey and how it should be put in place in the world. Moreover, I will talk about the benefits of GS1, a global language, and explain why we need a vaccine traceability system. I remember that the first executive dialogue, we need to encourage traceability system in place. We are going to deploy end-to-end traceability methods for the different countries. After giving general information about the traceability, I would like to ask you a question. How should vaccine traceability to everyone can understand? We need to answer this question accordingly. We definitely need a common language to establish global vaccine traceability system. This common language is provided by GS1. An easy, sustainable traceability system is established with the standards provided by GS1. Believe me, understanding and following the standards is very easy and simple. What matters is how these standards are properly followed. Let's talk about this a little bit. If we are looking at the Turkey, it established a vaccine traceability system using the GS1 standards in 2014. The vaccine tracing system operates independently of the pharmaceutical track and trace system and tracks vaccines. Briefly, each vaccine serialized uniquely is tracked by the vaccine tracking system. After the produced or imported vaccines are serialized, in both the vaccine collection center established by the government of the Republic of Turkey. By protecting the cold chain, they are sent to hospitals, vaccine administration centers, and pharmacies. As you can see on the screen, there is a data matrix image applied on the carton in accordance with the GS1 standards. Right now, I would like to talk about the current situation and insights of the vaccine traceability system and vaccination in Turkey. Undoubtedly, the system is going to be used GS1 standards. GTIN, expiry date, batch number, and serial number, and at this point important, we need additional two other application identifiers. AI99 and AI97. 97 use it for the calculation of the dosage. 99 is HL7 code. The Center of Disease Control of Prevention that came from CDC Immunization Information Center. In the meantime, as per used for calculation vaccine of the dosage, the government can pursue which brand or same brand different dosage vaccine use it. So that I would like to give the process of Turkey, how we can handle it. Turkey has two different methods. There are ones import production and bulk filling vaccines. In recent times, everyone uses to import vaccines extensively. In that case, the Turkish Ministry of Health get the actions and has established one huge warehouse due to the cold chain. The vaccines come to the warehouse with the original label. VISIOTT generates the label as per the customer requirements. If I give one example, one box is including 6 vials. 6 labels will put in the box, and more label is generated for the box and the applied. Later on, the aggregation will be compliant according to aggregation rules and traceability rules. Secondly, the production and the bulk filling vaccines, the manufacturing companies have established vaccine traceability system. VISIOTT helps vaccine traceability operation as per the customer requirements as well. They apply the unique number labels on the products with automatic vial labeling machines to be fast and more efficient. Later on, they create the aggregation operations. The data flow chart, as you can see on the screen, tells us about the vaccine traceability system used in Turkey. Vaccines can be different stakeholders. They are manufacturers, wholesalers, distributors, or 3PLs. Vaccines enter the countries in different ways. Either they may have been imported or they may be manufactured, I mentioned previous slide. With the established vaccine tracing system, vaccines vials are serialized with the unique code and serialization data is sent to the National Central Database by the EPCIS method. A simple mobile application written by the authority communicates with the national database. With the help of the mobile application, the citizen's ID and the unique code on the vaccines are matched and recorded. Although it may seem complex, it is an easy to implement form of data management. I guess what we need to get the correct results with the simple system can be implemented. And I would like to talk about immunization in Turkey a little bit. I guess this is the second step of the vaccination. All Turkish citizens are identified in the central national database. We need one database for the citizens first. We need one mobile application for communication between citizens' ID and the unique number. Someone needs to download the mobile app and demand vaccination. As you know, the government published a risk map for the vaccination. The system booked the date and the place. When someone arrives at the vaccination center, the healthcare staff scans the vaccination data markers code and puts into the patient ID into the mobile app. In the background, the Ministry of Health knows about which vaccine, when, and where, first and the second check. Let's start talking about the mobile app a little bit. The last step in vaccine traceability in administering the right vaccine to the right person. Vaccines are administered in administration centers with the help of the mobile application according to vaccine program. With the mobile application, the unique number matches the citizen's ID. Another advantage of the application is that it creates a vaccination program according to risk group. We can arrange collectively vaccination program. According to vaccination program, the vaccination of the people in the risk group is completed. At the end of the vaccination, the authorized obtain simultaneously data. The vaccination schedule is keep up to date using this data. We have one video, the video published 1 month ago and it came from the national press.
Az önce haberimizde de aktardık, anlattık sevgili izleyiciler. Herkesin aşısı kişiye özel, kendine tahsisli olacak. İşte Sağlık Bakanlığı bu konuyla ilgili olarak koronavirüs aşıları için kişiye özel kare kod uygulaması, şurada daha net, kare kod uygulaması başlattı. Yani hangi aşının kime, nerede, ne zaman yapılacağı kare koda işlenmiş olacak. Yani ben kendi aşımı işte anneme devretmek istiyorum, teyzeme devretmek istiyorum dediğinizde böyle bir şey mümkün olamayacak.
Aşılama programının son derece şeffaf yürütülmesi en büyük önceliğimizdir. Aşıların üzerinde bulunan kare kod sebebiyle ismine tahsis edilen kişi dışında aşının kullanılması da mümkün değildir.
Koronavirüs aşısı için randevu verilecek, uygulanacak olan aşı kodla kayıt altına alınacak. İsmine tahsis edilen kişi dışında aşının kullanılması mümkün olmayacak.
Kare kod uygulaması yapılıyor. Aşı takip sistemleri ülkemizde çok doğru bir şekilde, eksiksiz bir şekilde yapılıyor. Bu konuda arkadaşlarımız, sağlık çalışanlarımız tecrübeli.
Kare kod uygulamasıyla aşı için randevu alanların her gün takibi yapılacak.
O kişinin dışında başka kişinin zaten başka kişiye aşının yapılması mümkün değil. Ya da ben yaptırmıyorum, benim hakkımı şu kişi kullansın gibi bir durum da söz konusu değil. Sonuç itibariyle sistemden kimlerin aşılaması gerektiği, kimlerin sırası geldiği, ne zaman nereye gitmesi gerektiği an be an belirlenecek.
Kare kod uygulaması sayesinde aşılara kimlik veriliyor. Yani kim, nerede, hangi aşıyı yaptıracak hepsi önceden sistemde belli. Örneğin bu aşı odasında 4 kişi aşı yaptırdı. Onların bilgileri kare kod uygulaması sayesinde alındı.
Çok mutluyum. Bu Çin aşısına da güveniyorum. Sonsuz derecede güveniyorum. Aşının menşei önemli değil bence. Güvenlik etkinliği önemli. Aşı da güvenli ve etkin. Sonuna kadar güveniyorum.
Randevu alan kişinin tanımlanan zaman dilimi içinde aşı olması gerekiyor.
Yes. Here you can see the map. We can see each data on each city. Turkey implemented safety and effectiveness of the vaccine traceability system. I took the picture yesterday from a Turkish Ministry of Health in web page. The total number of vaccine applied, number of people who received first and the second dose. In order for all of us to better understand, we can see which brand vaccine use which patients or citizens also. That means we see on the screen secure supply chain. Transparency helps to build trust. Actually, we need to need the collaboration with the government, NGOs, private companies, non-profit organizations for to build the system. In fact, this is my humble opinion. First, we can think about one country's implementation for immunization supply chain. Later on, we have to gather all information in COVAX platform, etc. We need to do correct accelerator of vaccine supply chain. The COVID-19 pandemic has caused desperate damage to the country's economies and people's lives. For this reason, vaccine traceability has become even more essential with the effects of the pandemic today. Why do we need vaccine traceability? First of all, we need to understand this concept very well. I think we need to accurate vaccine traceability and vaccination program to prevent the devastation caused by the pandemic. If we cannot deliver the right vaccine to the people correctly, we will not able to reduce the effects of the pandemic. We can define them in the following areas: obtaining real-time data on vaccination, administering the right vaccine on the right risk group, preventing the administration of the counterfeit medicines, establishing a vaccination program suitable for its target risk groups and monitoring in real time, administration of the vaccine of the people without distributing and the supply chain. How does the VISIOTT help you? VISIOTT established a full-field vaccine traceability hardware software system for companies or government or non-profit organizations. Any collaboration between government systems or for the secure supply chain, mobile application developed for hospital staff and the citizens, provides cold chain data loggers, training, commissioning the system with the experienced staff. It's essential for all of us to reduce and eliminate the effects of the COVID-19 pandemic. Therefore, it is necessary to create feasible and traceable vaccine traceability system in a simple manner. Authorized can conduct vaccination operation by quickly creating national database. Especially in less developed countries, the central system can be established with the help of some organizations such as UNICEF, WHO, and the World Bank, etc. In this way, adequate vaccine serialization and vaccination operations can be completed using GS1 standards. Thank you for being in here. Thank you giving me this opportunity to share experience as VISIOTT. So I pass it to Susan.
Thank you so much, Ozgur. That was really interesting and very interesting to hear your personal experience and also that of VISIOTT and the work it's been doing. I've some very many questions coming in from the audience today, so that's really interesting. So certainly your presentations have generated a lot of discussion on the panel. I think what's really abundantly clear is the commonality of the challenges being faced across the various countries and lots of similarity in approaching solutions. So it talks to our earlier discussion around that collaboration to develop a global solution rather than trying to solve the same problem many, many times in each geography. I think that's become very clear through the various presentations that you've made. Ozgur, just a question for you, if you don't mind. You mentioned during your presentation that the Turkish health system has had traceability for vaccines since 2014. Did this enable a more rapid response, do you feel, or or was there additional modification or changes required to address the COVID-19 vaccine introduction?
It's a good question that, I mentioned before. The Turkish vaccine traceability system has established since 2014. We are using many different vaccines at this moment. For example, diphtheria, pertussis, tetanus, and hepatitis that using the same vaccine tracking systems. In that case, we don't need any additional modification or changes required for the COVID-19 vaccination operation in Turkey. So we are using the same rules that we are using the GS1 standards, and we are using this same immunization program for this purpose. Just be aware of that the importance for the vaccination of the COVID-19, some different rules for some different reasons.
Okay, thanks, Ozgur. Maybe a further question really around the cost of introducing traceability. I'm sure there are many people on the call who will ask about whether or not the cost is an impediment or an obstacle to introducing traceability. And perhaps maybe to Peter. Peter, would you like to maybe pick up on that and maybe share your views around cost as an obstacle or not?
Yes, well, I think perhaps New Zealand is very early in its vaccination cycle at the moment. We're only at the process at the moment now of doing of border workers and manage in quarantine workers. So we can't talk to the vaccination cost as yet in New Zealand. Because obviously we're very early because we've eliminated COVID. We're in that luxury situation. In terms of the contact tracing, that is clearly a different issue that I was mainly talking about. Contact tracing has been essential to management of the elimination status. That hasn't been cheap, of course. There's a lot of people, but the key thing is that the systems are there behind the scenes to work, and also people, citizens, need to help with that. So I think there are some costs involved. They haven't been particularly material here. The contact tracing app that I was talking about, $6.5 million, the total cost of that environment. So that's New Zealand dollars. So it's not a lot of money.
Sure. No, that's good feedback, Peter. And I suppose one of the challenges you have is the cost of not introducing something and the long-term costs that you accrue by just, I suppose, maybe having more human beings involved in the process of managing all of this rather than having some of the traceability to take some of that cost out. I suppose that's also a consideration for people on this call. I wonder, Shiobain, and maybe a specific question for you really, is around the Falsified Medicines Directive. So one of the questions that I've asked myself over the last year is whether or not that particular piece of legislation has helped jumpstart some of our traceability at European level. I just wondered if you had any thoughts or considerations around that, Shiobain.
Yeah, thank you, Suzanne. And if I might comment just on the previous question as well, because I think it's a really important point around cost. Yes, and that's sometimes where we get stuck, because to implement the GS1 standards, you might need an extra bit of cost up front. You might have to do some changes or tweaks to the IT systems, which we all know can be costly. But the return is huge, and it is very hard to explain that you have, as you say, the reduction in resources required and the accuracy of data and all that unseen data that you haven't had before that you can realize. So while it might require a little bit of thinking and time and a little bit of cost at the start, the rewards are huge and exponential. So I can only stress that, particularly if you're looking at such a huge program in terms of vaccinating a whole population, every second counts. So that's the just to answer that point. And then around the FMD, so the Falsified Medicines Directive, and I do think any kind of change like this, it is the drive. What are the key drivers? The key drivers are the customer on one side and the regulator on the other. And particularly when it comes to health, the customer doesn't always have such a strong voice because it's often individual hospitals. There aren't any kind of global players when it comes to healthcare providers. So actually regulation is really great in assisting the standardization, and certainly the work we're doing on the vaccine in Ireland and the rollout and the tracking of the vaccine. If we didn't have Falsified Medicines Directive, we'd probably have a whole hodgepodge of we'd probably have GS1 barcodes on the products, but they wouldn't all be to the standard of FMD. So it meant the implementation was much easier. And secondly, I would say as well that the COVID presents the opportunity of demonstrating how the barcode can be used, because I think up to now, FMD has been such a big change for industry and for the healthcare providers. People have just been scrambling to catch up and just keep abreast of what the regulation requires. But from a GS1 perspective, we would always say this is an opportunity, it's a huge opportunity. And COVID is a really good opportunity to demonstrate how we can jump into the next stage of actually getting the benefits out of the regulation.
Oh, thanks, Siobhan. In terms of the callers and those on the panel today, and those who submitted some questions, we've had quite a number of questions around some of the challenges around managing geographically dispersed populations. And I wondered maybe, I'm thinking perhaps maybe in Turkey, because of the size of the population, Ozgur, you might maybe give us some sense of your views around how traceability has been assisted in terms of managing those geographically dispersed populations or locations. Has that been something that you have found that the application of the standards and increased and improved traceability has helped with?
Yeah, actually, we have two systems. That one of them traceability, one of them central database. Traceability is generating the serial numbers, and central database is keeping some citizens' ID numbers. We have to following some vaccinations for this kind of COVID-19s. We have to be creative to distributing vaccines to geographical dispersion. The central database knows about it. The citizens, how old and where they live. This is very important. In that case, as we can see on the map, we know that all citizens were living and how old are they. In that case, we know that which vaccines is going to do in which place. In that case, we can tracking one with one mobile application and traceability unique number. If we can combine between unique citizens ID number and the unique data matrix number, that we can tracking in vaccination program accordingly. So we need to some standardization for these proposals, that we need to some central database in the background. If we can create the correct secure supply chain, we will following some rules, and we will following the data, keep up to date.
Thank you. That's really helpful, Ozgur. And then if we're thinking about how the application of standards and traceability can assist those in the low and middle income economies, does anybody have a particular view about how that might contribute? I'm wondering, maybe Peter, just based on the experience you've had through the various organizations you're engaged with, is there any view on that?
Yeah, well, I think the challenges of getting vaccinations out into the third world and our very developed economies are going to be quite critical. Certainly in the South Pacific, we have two classes of two groups. We have some of the developing economies where there is complete elimination strategy, but they are incredibly isolated. They don't have any they have no COVID, but they don't have any migration. Their economies are crashing. So they're very isolated. So there's clearly one priority to make sure that we can open up those economies. And so that's where the COVAX programs and others are happening. And certainly New Zealand is only using Pfizer. And the government has announced that the other vaccinations that we have secured from other players will be deployed in the South Pacific to those countries. So I think that's an example of how I think different countries need to work together. Obviously, there are other countries developing economy where there is a rampant COVID. That's an entirely different perspective whatsoever, and often they don't have the money to get, and they're certainly not first in line to get the vaccinations. So I can't speak with any authority about that group of countries. I don't know whether any of the other panelists can. So thank you.
Thanks, Peter. I just wonder as well around I'm just thinking of some of the comments you made during your own presentation, Peter, around the rollout of vaccine in New Zealand. And obviously you've been such a success story in terms of managing the pandemic, and your positivity levels, etc., are very low, if at all, at this stage. In terms of vaccine, let's just say resistance, maybe it's not the word to be used in your case. Will you have a unique dilemma in New Zealand around the uptake of the vaccine, or is it a different dilemma that we face, for example, in some of our own geographies around the anti-vax campaign and having trust in the system? Will it be different for you?
I think there are, of course, people that are classically anti-vaxxers here. I think there are some people that are waiting for confirmation that the vaccination is safe. But I think there's a risk in our country because we have eliminated COVID and multiple times, and we're now what we call a level 1, which is where virtually no restrictions whatsoever on our life. There is the risk of complacency. And I think this is where the biggest issue for us is. Some people might say, well, why do I need to take action? Because we haven't seen our relatives and our neighbours dying or getting infected. We can read about it on the TV, see it on the TV, or through connect networks like this. So complacency is probably more of an issue, I think, for us.
It's an interesting one, Peter. It's an interesting dilemma. It's slightly different than maybe ours, but I'm fascinated at the same time. I'm just wondering, maybe it's a last question, but I might put it to all three. And really, my question is whether or not COVID is the ultimate use case for product tracking and traceability. And does this now, our experience over the past year and the way we've had to respond to COVID, does that really set the standard for everything that follows? And are we going to see governments adopting traceability and barcoding and GS1 standards as just part and parcel of their go-to-market strategy? Or is this a once-off? I mean, are we going to be able to leverage this experience? Maybe Shiobain, go to you first.
Yeah, it's a great question. Of course, I'm biased, and I would like to say I believe absolutely yes, and I would like to see that happening. I think it is a fantastic opportunity to demonstrate the use case. As we say, it's a huge project. It has the scale. It's going to demonstrate. One of the things we're seeing is that where GS1 can really add value is actually working alongside our health service and assisting them in advising whatever the solution, whoever it is that they're engaging to provide the solution, but ensuring that the GS1 standards and traceability is understood so it can be designed in. I think there's still a lack of maturity, I suppose, in some of the software providers to actually really understand and design in barcode scanning solutions. I think that will definitely change at the other side of this. We'll have a much better knowledge in the market, and then hopefully that will then translate into other activities as well, not just in health, but also into other sectors. So yes, I think it is a great opportunity for us to demonstrate and even upskill not only our health service, but also the partners and providers of services into our health service.
And maybe, Ozgur, do you think this is a once-off, or are we going to use this experience to drive the improvements for the future?
Yeah, actually, we need to see some opportunities that, and we can see this kind of these opportunities for like that, but we have to following some GS1 standards as well. So if we can create one vaccine traceability operations, that we have to follow in GS1 standards for this kind of vaccination operation.
Yep, and maybe Peter?
And so vaccinations, obviously I can't talk to because this is very early, but in terms of the location management that I was talking about, I think the government and we are working to explore how we can leverage 570,000 GLNs that have been created very fast and are mandatory on every single business in New Zealand and every single location. So that standards-based work is happening now because obviously it could be a delivery point for physical goods, not just vaccinations, but everything, EDI powering. So I think there's a massive upside of this where standards have been rolled out under mandate, under urgency to every business. The key thing is how do we educate and work with the business to say there's something more. It's not just vaccinations. It's not just COVID. It's not just COVID poster locations. What's next?
Thanks, Peter.
That's what we're working on at the moment. Thank you.
Thank you. I have to thank all of the panelists. What a fantastic session, and thank you for sharing your experiences to Ozgur, Shiobain, Peter. Very, very many thanks for taking the time to share all of those experiences with the group online this morning, and for all of the questions that have been sent in. We will, of course, try to respond to all of them over the coming day. So thanks again. I'm going to hand back to you, Ulrike.
Thank you very much to you, Suzanne, and to all the speakers of this session. That was really, really great, and I hope for everybody who participates some inspiration to take these learnings, these activities, and to move forward in your environment also to really secure trust and safety in the supply chain. Thank you very much for being part of this. We will, on this topic, which is so important for all of us in this time, for sure continue the dialogue. So watch out for the next one. And let's not forget, safer, more efficient care starts with a simple scan. Be safe, be well. Thank you very much, and see you again.